And welcome back to The Factor Uncensored. Nationwide, combating a surge in drug use and deadly overdoses is top priority for healthcare officials. Dr. Danish with Archpoint Pain Institute joins us to talk about what happens to the body when someone has an overdose and how keeping Narcan in your home can help you save you or a family member.
What happens is that with any opioid, it decreases your respiratory drive. It decreases those ability for you to consume normal oxygen. And that's what opioids do. And that's why we see those cases of accidental deaths and overdoses on such an increase. And what this medication does, it reverses the effects. It binds to those receptors that are responsible for the breathing actions, and it disables the opioids from binding, so that way people don't develop the respiratory distress. And if they do, it goes and it competes with the opioid receptors, and it comes on board first to help combat that respiratory decrease that we see, to help fight folks who may not be breathing after they may have overdosed or they may have taken a drug that they were not aware of.
Now, for those who are wondering exactly where can you get this, and first of all, who should have it at home? Who are the prime candidates to get Narcan in their house?
Yeah, these are very appropriate for folks, anybody who's on any sort of opioids, pain medications, whether it be hydrocodone, Percocet, oxycodone, anything that's a opioid, for sure they should have this medication convenient for their family members. Obviously, if they're having difficulty breathing, or if they're not breathing, then their family members need to be known how to use this nasal spray to help reverse the effects. And so, yes, anybody who's on these pain medications, number one, and number two, anybody who has a history of any drug abuse, whether it be, maybe they're using marijuana or they're using other sorts of drugs. Because right now in the streets, we don't know what these medications or what these drugs may be laced with, and some of them may have those fentanyl or opioids that may decrease your respiratory drive.
And what about if you only suspect your children may be using drugs behind your back? Would you have it in the house just in case, but only accessible to you?
That's exactly right, Isiah. And the reason for this is because you never know what these medications, these drugs may be laced with, right? And so, you may walk into, Freddie's room and see he's not breathing. And so this is a good medication to have. Obviously, you want to call 911 immediately. That's the first thing you want to do. And if you have access to this medication, you want to get it on board. Now, according to Dr. Ali, the price for Narcan is between $50 to $100. You can find it at your local pharmacy.